Hello everyone. We are Team 11 and our project is about improving birth control options by reducing implant migration. A patient comes into their medical provider to get their birth control arm implant removed, which is typically a quick and routine procedure. But when the doctor feels the arm for the implant, it's not detectable on site. After an x-ray, the birth control implant is nowhere to be found in the patient's arm, so they have to take more x-rays. And after multiple more x-rays are taken of various parts of the body, it was found that the implant actually migrated from the patient's arm all the way into their lungs, as you can see in the picture on the right. It's been found that 3 million US patients choose arm implants as their primary contraceptive method, with 0.26% of patients reporting implant migration and 0.02% of patients reporting lost implants altogether. Although at a glance these numbers may seem small, this issue is extremely serious as migration can result in permanent nerve damage and life-threatening complications like pulmonary embolisms. Additionally, to remove such implants which have migrated into the lungs, endovascular retrieval is often used and can cost patients upwards of $14,000 for a single procedure. As a result, there is a dire need for forearm birth control implants which do not move from the site of implantation.
To mitigate the migration of birth control implants, our team is proposing a redesigned implant. Our implant is composed of a small cylindrical rod made of ethylene vinyl acetate. EVA is biocompatible, non-resorbable, and gives the implant the elasticity to bend and flex with the arm and also the compressive strength to handle being bumped or pressed. Contained inside the rod is etinogestrel, the synthetic birth control hormone that will be eluted from the polymer in a slow, controlled drug release profile at a rate of about 70 micrograms per day for the first 3 months, then decreases to about 30 micrograms per day. It also contains a barium sulfate layer, which can be detected in radiology imaging. Now, what makes our design unique are the retractable hooks that can anchor the implant in subcutaneous tissue and prevent movement. These hooks are made from polyurethane, a thermoresponsive shape memory polymer. At colder temperatures of 50 degrees Fahrenheit or 10 degrees Celsius, the implant surface is smooth. However, after insertion into the arm, the polyurethane responds to body temperature by changing its shape into hooks. Then an ice pack can be used on the arm to retract the hooks for easy removal.
In 2010, the Affordable Care Act made it so insurance companies are required to pay for all FDA-approved birth control. Insurance companies would also be responsible for the cost of the several x-rays and other medical procedures needed to locate and remove the implant after migration. If a patient does not have insurance, they will be required to cover the cost of the original birth control as well as post-migration investigation surgeries. One x-ray can cost around $60 to $260, so with several images happening, this total can add up quickly. Reducing migration with our implant not only reduces the financial burdens on insurance companies and individuals, but it also can reduce the risk of injury for the patient. Cases have been reported of subdermal birth control implants migrating to the lung or the pulmonary artery, causing shortness of breath, chest pain, and the possibility of much worse side effects. Although we may reduce some physical side effects of having a birth control implant, our implant will be a hormonal releasing material, which will still cause hormonal side effects.
Some of the other many forms of birth control include IUDs and oral birth control pills. With oral birth control, pills must be taken at a consistent time every single day without fail, making oral contraceptives a daily task. As a result, 10% of U.S. women opt to use a form of contraceptives like IUDs or birth control implants. However, the IUD insertion process is very invasive, and many patients are simply not comfortable with the necessary implantation procedures. At the moment, the only other birth control that goes under the skin in the arm in the US is Nexplanon, which, as stated before, has a 0.26% of their patients with migration of their implant, including a few which had gone into the pulmonary artery. With the anchorage design of our product, these numbers can be lower as our anchorage with smart polymer design allows the implant to not migrate or get lost, but also be easier for the removal process as the smart polymer hooks can fold in.